us and so okay. You can see the slide now, right?
Yes.
Okay. So can you see it full screen?
No, ma'am.
I see. Now let us to look.
No, ma'am.
Okay, good. So you have just drawn this table. So about three patients, Mr. Jones, Miss Rigby, and Mr. Dixon. Now we're going to listen to the doctor describing their behavior and make notes in this table about them. And you'll tell me if you can hear the recording.
Unit 9. Listening. 1.
Can you hear?
Mr. Jones.
Yes. Yes, ma'am.
Okay, good. Now.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
So let us listen for the second time, just to make sure that we don't miss any detail now.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Mhm. Well, now just what kind of information do we have about Mr. Jones? I mean,
Yes, ma'am. About the appearance, ma'am, she appeared self-neglected and withdrawn. And ma'am, about eye contact, she was not making any eye contact with anybody, even
mhm.
when talking. And ma'am, about manners, ma'am, this says that she was hugging, he was hugging himself and was preoccupied with himself only. And mode of speech, ma'am, he did not interacted much with the nurse and all. And ma'am, inside, what I can say in inside, ma'am,
Anxiety is
uh,
understanding that the person is ill, understanding himself as being ill.
oh,
There is no information
I
about
think,
this, I think, right?
yes, ma'am,
Mhm.
yes, ma'am, yes, ma'am. And about doctor's feeling, ma'am, the doctor said that after talking to him, he himself felt quite low mood, ma'am.
In low mood, right? You're right. Okay.
Yes, ma'am.
Thank you. So, and he was hugging himself, we should also say, right? So,
Yes,
like
ma'am.
Yes,
showing that
Preoccupied with himself.
yes, wasn't just didn't want to communicate with the doctor. Okay. What about Miss
Yes, ma'am.
Rigby? Who would like to speak about Miss Rigby?
Ma'am, can I?
Your name? Your name?
Eman,
Sorry.
ma'am.
You've done this about yes, Prerna, please. Mhm.
Yes, ma'am. About Miss Rigby, they said that she was very hyperactive and was very. She had appearance of very colorful clothes and all. In short word, we can say she was flamboyant. And
Mhm.
eye contact, they said that she was so talkative, like she had eye contact, and most of the hospital know her story. And talking about manner, she was hyperactive, and mode of speech, she was talkative, as people knew about her.
Mhm.
And about insight, I don't know about insight, but
Did
doctors,
mhm. Did she
she seemed
understand
well.
that her behavior was abnormal?
No, she was not abnormal.
Mhm.
Her was seeming like she don't have any problem, like
Mhm.
why she admitted that kind
Exactly.
of.
Mhm.
And doctors feeling, the doctor did not feel like she's abnormal. They felt like she's normal.
Actually, the doctor didn't say about his feelings after the
Yes.
interview. So
Yes, ma'am.
but I guess he understands that his her behavior was abnormal,
Yes,
and
ma'am. Not aware of abnormal. And
she
she's
was
not
not
aware of. She
Signs of
herself was
abnormal
not
behavior.
aware if something is wrong.
exactly. And so and about Mr. Dixon, who would like to speak about him?
Yes, ma'am. Can I try?
Just a minute. So Rafa, please. Mhm.
Yes, ma'am. Ma'am, Mr. Dixon in appearance seemed to be well dressed, ma'am.
Mhm.
And about eye contact, ma'am, whenever he was being asked, only then he was making an eye contact, ma'am. And about manner, ma'am, he seemed to be very worried and anxious, ma'am, maybe due to anxiety. And mode of speech, ma'am, he only replied to whatever it was asked, ma'am. And about doctor's feeling, ma'am, although it was comfortable, ma'am, but the doctor felt nervous at the end of the conversation.
Mhm. He says
and
that
also poor concentration, and he couldn't sit still.
Yes. Yes.
He
Okay.
was fidgeting.
Agitated.
Right.
He was
Yes.
agitated.
Right. And so we've listened to the doctors. How can we describe their diagnosis? So what is wrong with Mr. Jones?
Mr. Jones,
Mr.
ma'am,
Jones is
he must
depressed.
be depressed.
Yes, ma'am.
Depressed.
Depressed.
Depression.
Depressed.
Yes.
So Miss Rigby,
Ma'am, she must be maniac, maybe.
yes, she has mania.
ma'am.
And
Maniac.
Hyperactive.
Mr. Dixon, what is
And
his
anxiety.
situation?
Anxious, ma'am.
Anxiety.
He must be anxious.
Anxiety. Thank you. Okay, so
Unit 9.
if we move, if we move to the next slide, here we are going to read some information about Dr. Tom Turner. He is a psychiatrist, and so we are going to read about skills that are necessary for a good psychiatrist in his practice. And here is there are some skills mentioned here on this slide. Let us just look at them and try to predict which 5 skills are mentioned by Dr. Turner in his story. So we have 8, we should choose only 5, which are the most important in psychiatry practice. What do you think? So which of them?
Like being proficient in psychotherapy.
Okay, yes.
Listening to the
Clearly and
patient.
carefully.
Listening to the
Developing the
patient, ma'am.
patient trust.
Mhm.
And
Developing the patient
using
Developing
trust.
sympathy and
patient's
empathy.
trust.
Sympathy and empathy.
And
Developing
using the
patient's
sympathy and
trust.
Using
empathy.
sympathy and empathy, listening to the patient, being proficient in psychotherapy. What else?
And not judging the
Development
patient.
of patient's trust.
Stopping oneself from making judgment
Trust.
about the patient.
Yes, stopping oneself from making judgments. Do we have 5? Okay, good. Now let us read what Mr. Dr. Tom Turner says about himself. So here's the beginning of this is the beginning of the story, and let us listen to Madhumita. She is not here. Arun Chalam, can you read the beginning? Arun Chalam?
Yes, ma'am.
Yes, start please reading.
Yes, ma'am. Dr. Tom Turner. My name is Dr. Tom Turner, and I have been asked many times why I chose psychiatry. I chose in a period in A&E for my next undergraduate rotation when an opportunity to work on the psychiatric ward came up and seemed like an interesting option. So it wasn't something I had planned for a long time.
So you can see that he didn't plan. So and he was working in A&E, which stands for, do we remember?
Accident and emergency.
Accident and emergency.
Accident and emergency.
Okay, thank you. Well, the next slide is for, so, Priya. Read, please.
Yes, ma'am. Now I work as a local psychiatrist, which fits in perfectly with my lifestyle. I have followed a range of courses and training in various areas of psychotherapies, cognitive behavioral therapy, and so on. But the most important skill I think I have learned and they have carried me through these years are those emphasized in my internship by my mentors and which still hold true today.
So we are coming to these skills, and so let us read about them, and it will be Prerna. Prerna, hello, are you here?
Yes, ma'am.
Read, please.
Dr. Tom Turner, first of all, there is being able to allow time to help in the healing process for the patient, the family, and the doctor. Coming from the hectic life of my previous department, I now seem to be moving in another dimension. I soon found that impatience was not going to help me or the patients, and that the whole process began with the first contact through the discharge from a ward.
It's interesting. Just changing attitude to time here. Well, the next part of the story is for Nishat.
Yes, ma'am. Listening is another but no less valuable skill. I had, of course, done a lot in my trainings, but worked on the ward impressed upon me the effect on the patient of just having someone taking time to listen. And through this came trust. Being non-judgmental as we listen to patients is another important technique, as otherwise there is a danger of patient's alienation. Finally, there is the ability to use our skill of daily living, which we can teach to patients as they prepare for discharge.
Thank you. There is a word alienation. What does it mean?
To feel like an alien, like or
Like
outward,
apart,
out people,
separated.
separated, isolated people.
Oh, yes. Okay, good. Well, so this is the information about Dr. Tom Turner. And let us look one more time at at the skills and which skills did he really mention in his story. We were right about what about developing the patient's trust, right?
Yes, ma'am.
About listening
Yes,
to
ma'am.
What else?
Listening to stopping oneself from
Listening.
making judgments about patients.
Yes, about judgments.
Being
And
proficient in
For
uh,
daily
so
living.
he didn't speak
Yes,
about
please.
being professional in just proficient in psychotherapy, but he speaks about two more skills. What are they?
Like listening to the
Listening
patient
to the patient.
and ability to
and
use our
letting
skill of daily living,
Yes, you are right. So the first skill, just
knowing
knowing
how
how
to
to
use
use
one's
those
own.
skills, daily life skills. And also letting time run its course. Yes, not to be in a
Yes.
hurry. Okay, and let us just move to the next slide. This is let us focus on the language, on the grammar forms which were used by the doctor. Dr. Turner says, I had chosen a period of A&D for my next undergraduate rotation when an opportunity to work on a psychiatric ward came up. So we have two verbs here like had chosen and came up. So the first had chosen, this is the form of the past perfect tense. And came up, this is the past simple tense, as you know. And there's one more example. It wasn't something I had planned for a long time. Also, two grammar forms I used, different grammar forms I used in one sentence. Wasn't, this is past simple, and had planned the past perfect tense. So the rule, you should use past simple and the past perfect to describe an event or period which happened before a point or period in the past. And past perfect describes the action which happened earlier. And the form of the past perfect tense, as you know, this is auxiliary had plus the past participle, or this is the third form of the irregular verb, an irregular verb. And when do we use the past perfect tense? The past perfect takes place before another past action. And example here, I noticed that he had left his books behind. So I noticed this is the past action, but had left happened earlier.
Past perfect.
Yes, this is the past perfect before I noticed it. So before the another past action. And so if we just have a look at the timeline, we see that in one sentence there can be two verbs in the past simple. This is what happened in the past, and another action action described with the help of the past perfect tense. This action happened before this, the past action. Well, and so these expressions are commonly used with the past perfect tense, like after I had eaten, I returned to work. So had eaten, this is the past perfect. The shift was over by the time I had written up the notes. So also two actions, was over in the past by the time had written up. So this is the past perfect. The next, I had already left the ward when he arrived. Also two actions, arrived in the past and had left before he arrived. So the action happened early and already shows this. And I fell asleep before I had finished studying. So fell asleep in the past and just had finished. So this is the earlier action. And once I'd finished washing my hands, I was ready to begin. I was ready, and before this, I had finished. So the other action. So here are the markers of the past perfect tense. And if we look to the next slide, we can see several sentences, and the task here is to complete the sentences by putting the verbs in the correct tense. So let us just look at the first sentence, and so it says, Dr. Glover already finished his ward rounds when the consultant telephoned. So there are two verbs here in this sentence, and we should use them in two different tenses, the past simple or the past perfect tense. So, and we should compare which action just happened first, finish or telephone. Any ideas?
Finished.
Finished, ma'am.
Finish happened first. That is why we need to use the finish in the past perfect. So Dr. Glover had already finished his ward rounds when the consultant telephoned, right?
Yeah.
So please look at the other sentences, and just I'll give you 3 minutes to write, to use the verbs in the sentences in the correct form, the past simple or the past perfect tense. Start, please. Well, let us start and just read the second sentence. And now let us listen to Prakriti.
Ma'am, second sentence.
Right. Mhm.
The doctor rushed to the ward, but the patient already disappeared. Ma'am, the doctor rushed to the ward, but the patient already disappeared.
So I didn't get it. So where did you use the past perfect tense? Rush or disappear? So which action happened first?
Disappearance.
Ma'am,
Disappeared.
disappeared. Ma'am, disappeared.
So that is why we need to use disappear in the past perfect tense, right? So past simple for rush is rushed. So the doctor rushed to the ward, but the patient
Was already disappeared.
Was already disappeared.
had already disappeared. Okay. So the next is for Samhita, please.
Yes, ma'am. I do some assignments. I do some assignment tests before, so I know what to do. I did some assignment tests before, so I know what to do.
So the first action do happened first, right?
Yes, ma'am.
So
Yes, ma'am.
I had done some assignments test before, so I knew what to do, right? Mhm. Okay, so number 4 is for Rafa, please.
Yes, ma'am. Mrs. Scott dash well known to the police. They dash her once before and dash her to the hospital. Mrs. Scott was well known to the police. They arrested her once before and brought her to the hospital.
Where did you use the past perfect?
For bring, it is brought, ma'am. And they already arrested, ma'am.
They
So
had
it is
already.
arrest.
Mhm,
Yes,
okay, yes, right. The next is for Aimin.
So, ma'am, the next sentence is you make up your mind about your future career when you be at secondary school. So it would be the first action is make up, ma'am. So it will be, ma'am, you made up your mind about your future career when you be at senior school.
And be should be in the past simple. What is the past simple of be?
You had been.
No. So the past simple, not the past perfect. When you, the second form of be is, who can help us?
What?
This is were, right? When you were at secondary
yes,
school.
Yes,
And this is the question, the general question, and we should start with an auxiliary. Had you
right,
made,
ma'am. Yes, ma'am.
had you made any, had you made up your mind? Okay. So the next is for Arun Chalam, number 6, please.
He not complete his internship by the time he leave his country. He did not complete his internship by the time he left his home country.
What happened first? Complete or leave?
Ma'am, he did not complete, so we can add did, ma'am, did not complete his internship by the time he left his home country.
By the time shows that complete happened first. He hadn't completed his internship by the time he left his home country. Yeah. So then, Priya. Priya, hello. No, Priya. So, Prerna, please, number 7.
Yes, ma'am. In 1960, a year after Roche first synthesized diazepam, Roche, along with Merck and Lundbeck, introduced amitriptyline to the market. So it will be Roche first synthesized diazepam, and then they
You can use past
Introduce.
perfect here in the first case. Roche had first
Roche
synthesized
had first synthesized diazepam, and along with them, they introduced
the past simple. Okay, thank you. So I would like you to focus on the story. It's rather just on the article about what to do, how to elicit the history from people with a psychiatric disorder. This is just the article. It's rather complicated, but anyway, and we are short of time. Let us try to read it. So, and let us listen to Nishat. Start reading, please.
Yes, ma'am. Eliciting the history. Introduce yourself, explain to the patient how long the interview will take, and explain its purpose. Find out how the patient came to refer and what his expectations are. Example about treatment. If the patient denies having any problems or is reluctant to start talking about himself, do not hurry him. Try asking, how are you? What has been happening to you? What are the most important things? Another approach for hospital patient is to indicate why the general practitioner referred to the patient and then ask what the patient thinks about this. Sit back and listen without interrupting. Nothing exact examples of what the patient is saying. Take more control after about 3 minutes to cover the following topics.
So this is about the same skills that Dr. Turner was speaking about, right? Well,
Yes,
the next part of information is for Prakriti. Prakriti, are you here?
Yes, ma'am.
Read, please.
Yes, ma'am. Presenting the symptom, agree a problem list with the patient early and be sure it is comprehensive. Example, by asking if we were able to deal with all this, would them be all right? Yeah, or if I were to help you, how would things be different? Then take each problem in turn and find out about the onset, the duration, the effect on the patient life and family. Every coinciding with the onset, the solution tried, reason why they are failed. The next step is it inquiry about moods and belief during the last week. This is the different from the mental state examination, which is referred to the mental state at the time of interview.
Thank you. So this reminds us the Socrates model. Some questions are from this model that we were speaking previously. So it is divided into several steps. And so let us listen to Samhita.
Yes, ma'am. Especially check for suicidal thoughts, plans, or action. The more specific these are, greater danger. Discussing suicide does not increase the danger. Depression, low mood, anhedonia, unable to feel pleasure, self-degradation. Oh, I wish I had not been born. Guilt. It's all my fault. Lack of interest in hobbies and friends, plus biological markers of depression. Early morning waking, decreased in appetite and sexual activity, weight loss. Mania, symptoms of psychosis, uh, persecutory beliefs, delusions, hallucinations, drug and alcohol use, obsessional thoughts, anxiety, eating disorder. Example, young women often not volunteered and important. Note compulsive behavior. Example, excessive hand washing.
Okay, so these are the common just psychiatric disorders. And so unfortunately, we don't have time on the discussion of questions. I would like you to just to focus on the final slide here. So we're finishing our course, and you know that we are finishing the last 5-week period, and we should take the midterm 3 test, and you'll deal with this test after this class. So you should complete it on the Moodle site, and the test covers the topics and grammar structures of the units which we studied during this third period. And there are 22 questions in this test, and there are 3 types of questions. True, false. You just have to choose one option, and matching questions. You should match, for example, the terms and their definitions or something else, and select missing words, which is in the text. You need to use the correct option instead of the gap in the text, and the options are suggested, so according to the context. So at the end of the test, you'll click the save button, and you'll have 30 minutes to work with the test. And after this time, the test will close automatically. And so I'll just open the access to the test exactly after this class. And it will be open just 1 hour, and you should just start and finish in 30 minutes. So this is the task that summarizes what we've learned so this period of time.